I'll be talking about major depressive disorder. According to the National Institute of Mental Health, major depressive disorder affects approximately 17.3 million American adults, or about 7.1% of the US population aged 18 and older in a given year. And given that major depression is a serious mental health condition that can lead to suicidal thoughts or even suicide, I thought it would be an important topic to cover today. I will be going over the symptoms, the causes, and treatment. But first, I want to welcome you to my channel. I'm Micheline and I make mental health videos once a week, so please make sure that you hit the subscribe button and turn on your notifications so that way you never miss an update. Also, if you're enjoying my videos and you want to support me, please drop a comment below and like this video or share this video. I always love to chat with you and hear from you, and you will be helping others have access to this information. So let's dive into depression. But before I list the symptoms, I will remind you that this is not intended for self-diagnosis. This is for informational purposes only, so that you can make an informed decision as to whether or not to seek mental health treatment or to help you better understand your symptoms and yourself and what's going on internally for you and what you're experiencing. So here are the symptoms. The first symptom is feelings of sadness, tearfulness, emptiness, or hopelessness. The second symptom is angry outbursts, irritability, or frustration, even over small things. The third symptom is loss of interest or pleasure in most or all normal activities, including sex, hobbies, or sports. Number 4, sleep disturbances, including insomnia or sleeping too much. Number 5, fatigue and lack of energy. So even small tasks take an extreme amount of effort. Number 6, reduced appetite and weight loss or increased food cravings and weight gain. Number 7, anxiety, agitation, and restlessness. Number 8, slow thinking, speaking, or body movements. Number 9, feelings of worthlessness or guilt, or fixating on past failures or self-blame. Number 10, trouble thinking, concentrating, making decisions, and remembering things. And number 11, frequent or recurrent thoughts of death, suicidal thoughts, suicide attempts. And number 12, unexplained physical problems such as back pain or headaches. For many people with depression, symptoms usually are severe enough to cause problems in functioning of their day-to-day activities, such as going to school or going to work or going out with friends or interacting with people, and they have trouble with their relationships. And some people may feel overall just miserable, unhappy, and not really know why. So what causes depression? According to a study published in the Journal of Neuroscience, it was shown that the hippocampus, which is the brain region that's responsible for learning and memory, is smaller in some depressed people. The research found that on average, the hippocampus was 9% to 13% smaller in depressed women compared with those who were not depressed. The more bouts of depression a woman had, the smaller the hippocampus. Stress, which plays a big role in depression, may be a key factor here, since experts believe that stress can suppress the production of new neurons in the hippocampus. Depression is very complicated, and there is no single one thing that has been found to cause it. And much research points to a combination of things such as trauma, genetics, life circumstances, brain changes, medical condition, and drug or alcohol misuse. So, what are the treatments for depression? The best treatment for depression has consistently been a combination of medication and psychotherapy. So the best psychotherapy to use are the cognitive behavioral approaches, which work on helping you with the thought processing and then encouraging you to get back into doing the things that you love. And then the medication that can help regulate any imbalance that can be occurring in the brain. And through therapy and medication, you can also help process and cope with the stressors that have led to the depression in the first place. I hope that you found this information helpful. Please chat with me in the comments. What has helped you through your depression? If you've experienced major depressive disorder, what seemed to work? And what do you continue to struggle with? Love to chat with you below.